So what is arthritis? It is a whole joint disease. So a lot of people think of it as bone on bone or wear and tear or my cartilage. But arthritis consists of everything from the capsule to the ligaments and tendons around it to the synovial lining, which makes the fluid in the joint that lubricates it, okay? Think of a ball bearing. You can't have a ball bearing work well without oil. It has to have lubrication. So it's a whole joint disease. It is what's called an NCD. So this is a new phrase you may not have heard, but it's kind of coming more and more prominent in science and in medicine. Non-communicable disease. What does that mean? You can't catch it. So COVID is a communicable disease. Cholera is communicable. Tuberculosis is communicable. I can communicate it to you. Arthritis, heart disease, atherosclerosis, stroke, Alzheimer's, cancer, you name it, those are non-communicable. You can't catch it from me. Okay, a lot of people think of arthritis solely as wear and tear. That's what I was taught. That is not, in fact, true. Could it be wear and tear? I guess so. But the fundamental building blocks that allow such wear and tear to occur have nothing to do with the wear and tear. It's almost like they're correlated, but not causal. Same thing with post-traumatic. Now, if you have a fracture through the actual joint surface of your bone, yeah, that can lead to post-traumatic arthritis. But just a random event where you have a bit of impact or a twisting mechanism, generally speaking, the body has enough capability to heal that should not matter long-term. And in many cases, just like atherosclerosis and diabetes, cancer, also like cognitive decline, a lot of this can be treatable and reversible just by changing a few fundamental things about how we're living our lives. So it denotes inflammation, the term arthritis. So remember, a lot of our medical terms come from Latin. So let's talk about inflammation quickly, because for you to understand how all the things are going to work, you have to understand the fundamental problem. Okay, so the Latin word inflammare, to set on fire. So that's what inflammation denotes. It's hot, it's painful, there's a lot of energy released. Hippocrates, who of course was the originator of the Hippocratic Oath, which I took when I graduated medical school, he described inflammation as a response to injury in the 5th century before Christ. So this is like 500 years before Christ was born. This is being described. He also gave us the terms for edema and sepsis, terms we still use today. Edema meaning swelling, and sepsis meaning full body inflammation or infection. The 4 cardinal signs of inflammation were described 2,000 years ago. So again, Latin, rubor et tumor cum calor et dolor. What does that mean? Redness, swelling, heat, pain. If you went and asked your doctor today, what is inflammation? They would say redness, heat, swelling, and pain. Okay, those are the 4 signs that we were taught. That's what we look for. But that's acute inflammation, which we're about to talk about. And then Galen thought inflammation simply allowed blood to escape the arteries. Now, there is a component of that which leads to the redness and the swelling, but that's not all inflammation is.